is up, Twitch? Welcome to the Raised Flaves Radio Show. Lunchtime with Raised Flaves, lunchtime hour, lunchtime, quick lunchtime live. 30 minutes, exactly 30 minutes for lunch. We spent 5 of that on the intro right there, so we got to go quickly. Lunchtime live, lunchtime live. Welcome to the chat. Fire in the chat, fire in the chat. Juice gang gang, juice gang gang, juice gang gang. This is the time to talk about our health. Right during lunchtime, right when we're about to decide what to eat for lunch, we got to get healthier. We've got to do healthier things for us, so this is the right time to talk about your health. And today's guest is perfect for this episode. She is a pharmacist, and not just any pharmacist. She has a doctorate in pharmacy. She's a real doctor. She's amazing. She recently wrote a book called Off Balance, the American Way of Health, with the subtitle, Why Drugs Don't Work, a Pharmacist Perspective. Please help me welcome Dr. Leyla to the show. Dr. Leyla, how's it going?
Thank you. Great. Thank you so much for having me.
Absolutely.
And, great intro. I appreciate it.
Absolutely. Thanks for coming in. Thanks for taking the time. We got about 30 minutes to get through all this stuff. There's so much to unpack here. Your recent book, American Way of Health, the off balance thing. You're a pharmacist. Your job is to distribute drugs to us. You're supposed to get us high on drugs, get us addicted to drugs, make us stay on drugs for life. What's going on with you, my friend? What are you doing to your career there?
They don't need me for that. They've already done a good job with that. They don't need me pushing drugs, right?
So the doctor does it there, really, to correct myself, right?
It's the whole system. It's the commercials on TV, and
right.
Doctors and pharmacists are only trained in drugs. We don't get any training in nutrition and emotions or anything like that. So it's a huge system. It's just...
Totally, 100%. You got commercials coming out the wing. This drug will fix this, but then it'll ruin your kidney, ruin your liver. You won't be able to pee right, but you'll be able to see straight. It's fantastic. There's all these crazy drugs.
Exactly. And what a lot of people don't know is those commercials on TV, they're only legal to have them. It's called direct-to-consumer advertising, where they advertise right to the people. Most of the time, they only advertise to medical professionals. So only in 2 countries in the world, the United States and New Zealand, are they allowed to advertise right to the consumer.
What?
And because of that, we get them. Yeah, because of them, we get them slammed. I mean, they're on 24/7, right? So people forget that there's natural ways. If they're on TV, they spend a lot of money on it. If there's a natural, simple remedy, they can't afford the commercials. So...
That's crazy. If there's a natural system, yeah, exactly. So somebody's selling natural stuff that don't make no money.
You'll never see somebody on acupuncture on TV, right?
Yeah, your honey and oatmeal mixture is not going to sell very well. It's the drugs that sell good in America.
They have to have that patent. They have to take nature, modify it, and then they own it, right? So if something's natural, you won't see it on TV, right? I mean, unless someone's making money off of it.
Crazy. Quick disclaimer. You see the disclaimer there, exclamation disclaimer, informational purposes only on this show. This podcast is for informational purposes only. The information provided on this podcast is not intended to be a substitute for professional medical advice, diagnosis or treatment. Always seek the advice of your physician or an other qualified health provider with any questions you may have regarding your own health. That's our disclaimer. By the way, so when you went to school, you're learning about all these drugs. You're learning about how drugs work. Where did you go to school at?
I went to University of Pacific up in Stockton, California.
Okay, cool.
So, I grew up in a household. My father was a medical doctor, surgeon. My mother is a surgical technologist. So I didn't know anything about natural remedies until I got out of school.
Dad, surgeon. Mom does what?
Surgical technologist. She'll do the instruments in surgery, where she sterilizes them and is present in surgery and stuff like that.
So this is beyond your education. This is a normal life for you as a kid growing up. You're seeing doctors, trusted doctors, doing their surgeries, needing obviously the help of medicines that help in whether it's pain, whether it's different things that they're tackling health-wise. You're seeing this all throughout your life. You go to school. At what point is it during school, during your training, that you start to see, whoa, something's a little quirky here? So what point do you start to see the change?
A couple epiphanies, but there's one after pharmacy school when everybody was cleansing and it was very trendy. You know, everybody's like, "Oh, let's do a cleanse, get the toxins out." I learned nothing about that in pharmacy school. So I asked a friend of mine. I said, "Well, give me one of those cleanses," you know. And he brought me over a couple books, and I'm like, "I'm just going to skim it just to get the idea." And instead, I started reading this book from cover to cover, and it said 95% of diseases are caused by what you eat. And I'm like,
Whoa.
that can't be true. That was true. Like I've never heard that. So here I am. They gave me a doctor title in healthcare. I should know that if it was true. And at that point, I pulled out my therapeutics book. It's like 1,600 pages, and it has all the disease states and the first line prognosis and the therapies. And I started looking up causes of simple diseases, and they were all vague, like acne. The cause is multifactorial and not completely understood. And I think acid reflux, it was like balance between defense mechanisms and aggressive factors. All jibber jabber that we had to memorize.
That's what I
And
deal
it
with
didn't.
myself. So this is good information.
Right.
I figured, and what I'm told, let's start with that one right there, is I eat and then I lay down and then the stuff comes up. And that's what they tell me is the cause. Is that true?
It's part of it. I mean, that's one cause. Some people have it when they lay down. And,
Right.
there's the acid is much more, the stomach is much more acidic than the esophagus, So if you lay down, that little valve opens up, it'll come back up. So
Holy moly. Gotta
that's,
stop doing that. Holy moly. My doctor's
yeah.
right. Crazy.
Or don't eat too late, right?
And don't, yeah, so
Yeah.
crazy. Talk about, that's part of it, I think, also, besides all the drugs that were pushed online or things like that. We have this lifestyle in America where it's fast paced, you go, 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 go. We're finishing this podcast in about 20 minutes here because we're trying to go back to work. So everything is fast paced. We're trying to do stuff, go to work, take the kids here, take the kids there. My wife doesn't get off till 5 o'clock. Then she does a few more things on the computer till 6 o'clock, starts dinner. And then we eat around 7, maybe earliest. And then it's late. We get tired. We lay down. We have this fast paced lifestyle in America.
Right. And it's true. And even with acid reflux, I have one class where I teach on that. And one of the first things is to chew your food. So a lot of times we're eating when we're not thinking. And if you chew your food and you get it to a liquid, like 30 times more than you would normally think or ever do naturally,
30 times more.
then yeah, 30 times it's a liquid, it's a lot less stress on your stomach. And that step alone can stop acid reflux.
I gotta
You know what I
watch
mean?
my son. He takes like an hour to eat a chicken nugget. So he's doing everything right. I should watch
He
him.
does not have acid reflux.
He has no acid reflux whatsoever. He has a great stomach.
Yeah.
That's crazy.
There's also some foods that create acid. They need acid to be broken down. So you can become aware of those. And that's, of course, the processed foods and meats and dairies and things like that. But another
Yeah.
big step for acid reflux is relax while you're eating. All right, we have the fight and flight mode in our body where you're under stress, and then there's the relax mode. Digestion works when we're relaxed. So people eating while they're under low levels of stress all day is not great for digestion. So when you guys finally do sit down, if you carve out that time, make sure that, I mean, whatever you're talking about, whatever's going on is a positive, relaxed thing, and not just, okay, got to get to the next thing, but carve out time to be calm, have good thoughts, be grateful for things, then it'll be great for your digestion too.
That would be incredible if yes, that would be incredible. Some not positive. At the end of the day, that's usually when all the guess what happened today? Guess this, got to fix that, got to do this. So that's but gotta work it out. We gotta work it out.
Something to aim for anyway, right?
Yes, hell yeah, that's awesome. That's awesome. Yeah. So you're in school. You get out of school. You learn about these people cleansing. What around what year is this? Around what year is this?
This was about 2006. You said the book came out recently. The Off Balance: The American Way of Health: A Pharmacist's Perspective on Why Drugs Don't Work. After I learned that it was a scam, I started reading, and I held monthly mixers, and I would meet 3 different practitioners every month to come and learn what they do. And that's the time. So my book actually came out in 2012.
2012. Okay. 2012 was the book.
This one right here.
Awesome. There it is. You can get that on Amazon?
Yeah, Amazon. Yeah.
Perfect. There it is.
And then I just wrote a new one last year. And that's, so you've been diagnosed with cancer and now you're in a panic handbook.
Wow.
It's like an overview of options. Oh,
Holy moly, that's a big one because yeah,
yeah,
when
and
some
it's a light book, so they're both like super easy reading, like no big words in them. You know what I mean? It's just made for anybody.
easy read,
Yeah,
love that, love
yeah,
that. It says yeah, like I said, a quick lifestyle. You need something quick to get through, but yeah, it's crazy. You hear something like that, you definitely need some support. But you're hearing about all these things in 2006, the cleansing stuff. Your most and where I heard you talked about hearing that food was a lot of the cause of some of our problems. One of the videos I saw, or the first time I ever heard that kind of talk, was on Forks Not Knives. Have you seen that
oh
movie?
yeah, forks and knives.
Yeah,
Yeah,
yeah, it's like more of like vegetarian style lifestyle type of movie.
mhm.
It's crazy, but they talk about that, like how Socrates used to say, like the the key to health
Hippocrates,
was
like
like
food be like medicine, right?
yes. Say that again.
Yeah. And the China Study is a great book to read, and they're just talking about people that eat the natural foods from the earth. You know, the paleo diet. If you're eating something, if it's around 1,000 years ago, it's not processed, modified, injected with this or that. You know what I mean? It's just food from the earth, and if we stick to that diet, we're fine. We're healthy, and people eat all kinds of stuff all over the world, right? I mean, some have more fish, some have this or that, but if you go from the earth, we're okay.
Yeah, I like that. China, they brought up that China study in the movie, how certain parts of China that were more in produce and eating stuff off the land had less cases of like leukemia, blood cancer, stuff like that. So it's a pretty
Everything.
incredible thing.
Yeah.
As a barbecue guy, I should be listening to that more.
Well, in the old days too, people like they are against meat, but the paleo people would eat nuts and seeds and fruits and have the meat once in a while, not 3 times a day, but meat. And so I know some vegetarians, they were vegans, vegetarians, they went back and they're doing meat now again. So maybe we need it at some level. So I'm not totally against the meat, but I think you eat it 3 times a day. It's kind of slow to digest, but I think you might need the protein in there too.
Yeah, it takes a long time to digest. Yeah, I was a vegetarian for 10 years and I used to look slim, trim. My numbers were great. And now I'm this. I eat meat again. After 2020, once I was stuck at home with COVID, I bought a smoker and I was smoking all kinds of meat. So I just ended up like
Were
giving
you
up on
vegan
that.
or vegetarian? Were
I
you
was
vegan?
vegetarian, vegetarian.
Yes, you had some cheese still in.
Some cheese, fish as well. I did, more
So,
Mediterranean style diet, but
yeah, see, that's
nothing
great.
crazy. But yeah, it did have a big benefit on my health, my cholesterol levels, my everything, my blood pressure, everything. It was crazy. That's crazy. So when you discovered this type of thing, you run back to your colleagues and say, "Hey, look what I found, guys!" And they all jump in and like teamwork with you, and they go to the Dr. Oz show. What happens?
I don't think, see, that's the thing. There's a lot of resistance in the profession, especially the people that get right out of school, nursing, pharmacy, doctors, all of them. And they're taught arrogance as well. And
Mm,
plus, you don't want to know. Here you went to school for 4 years, you got student loans,
you paid for
and
that.
some schmuck's gonna come and tell you it's all wrong. Like, why would they believe you? You know what I mean? They don't want to believe you. It's a you got to go down the rabbit holes then, and it's a just definitely a harder path to take. It's easier if you just like your job, pay off your loans, and make some money. But no, most pharmacists I know are not open to. There's only a handful I met now that are. Even I wrote the book 12 years ago, right?
Yeah.
And so I've been on the path, at least 15, 16 years, and pharmacists are pretty slow to jump on the bandwagon, but more and more people are kind of waking up, especially with COVID, where they left people getting sick. When they have the simple solutions, that's kind of the thing. There's simple solutions to treat things, yet they let you stay sick. And when people look back like 100 years ago, they'll be like, wow, people are spending all that time and energy on diabetes. I mean, they get tested, they have complications, they have, and it's so not necessary. I mean, you could reverse it in a couple of weeks. And even if you have type 1, you could do really well with it. Diet, fasting, different things that can really help with it. So I
Diet
got
and
to look back and
exercise.
go, what were these guys doing? This is crazy.
Why do you think doctors are so slow to change? I mean, they're sworn to need to help us, right? To make us healthy. And you would think that they want to they would want to find better ways than drugs. Why do you think they're so slow to change? Is there some sort of like incentive for them to like not change into the natural type cures?
I mean, I think there's a lot. I mean, besides they're getting past their own arrogance on it too. Like there's arrogance. Like I picture like a medical school, you get out and the final exam is building your own pedestal. So you make a big old pedestal. So
Your first project is build your own pedestal. I love that.
yeah, exactly.
That
How
gives us
big is
a vision of exactly what you're talking about. How the doctor, like big headed, comes out of school, he thinks he knows everything, he is trained, and he's on that pedestal. What are you going to tell him about natural medicine and stuff like that? He's like, wow.
Yeah, and it's very humbling. People sometimes I realize sometimes I'm planting the seed and people don't see it till later. Like they're just like, whatever. You know what I mean? And
Yeah.
sometimes they won't get it for a long time. And other times they already know it. So sometimes you're just saying, look at watch this. And the book, I wrote the book with the things like nobody's going to look at me and believe me over these other doctors that use bigger words and wear white coat. You know what I'm saying? So I
Yeah.
mean, it's so you can see it yourself. You can see the pharmaceutical ads on TV. You can see how sick people are with diabetes over years and how bad the diabetes American Diabetes Association has been in getting people healed from diabetes. If you go to the American Diabetes Association, right, and they're always raising money to find a cure, you
Right.
don't see anything. You can see like how much money it's like $16,000 per patient per year. But you can go on this one site and it's called reversing diabetes in 30 days. And these guys that have high levels of sugar that they can't get down on multiple medications in 30 days, they're pretty much reversed it.
30
I
days.
mean, 30 days. And do you think they have anything about raw food or intermittent fasting on there, on the American Diabetes Association website? Nothing. All they want to do is find the next drug and raise money. And so like it's that bad. It's that simple to reverse it. In 30 days, you could do amazing things for almost all diabetics.
Wow,
You
that's
know,
incredible. Hanada says, my meal did a 3-day fast, and her daughter told her she heard that if you fast for a week, it helps clear cancer cells from your body. Is that true? That's a question from Hanada.
that is true. They're saying when you start fasting, the first things that die away are the toxins and the dead cells and cancer cells. So one of my friends actually did that. She's been to natural therapy sessions with me. Like I've been to Optimum Health Institute, and you see people there where the guy could barely walk. He had cancer, and in a week he was a different
Jeez.
person, eating raw food and just detoxing. And so that's the first thing that goes. She had radiation and surgery for breast cancer, and there, of course, they don't work. They'll give you one and go, well, it didn't work. Now let's do radiation. Oh, that didn't work. Let's do chemo. And I'm like, you do chemo, you're gonna have, people have chemo brain. It's toxins all through your body. She did a 21-day water fast, and this is a friend of mine who you does not take that lightly. But there's videos and stuff that can help you do it, and she reversed it. And she felt great. She got rid of all the cancer.
That's
But it took there.
crazy.
Yeah, so when people go, I can't afford cancer therapy. There's you could save money on water fast. You got to really prepare for it mentally.
21-day
And you
water
have
fast only. Is that what they do?
mhm, yes,
Wow.
21-day
Before
water fast.
before we
But
run
there's
out of time, I want to get to your stuff that you do. So like you have a facility where people go to like if they have health problems.
No, I can do online consults. Online consults. I'm doing a weekly deprescribing class, free for anybody that wants to come. So we
Okay.
talk about different ways to get off meds, and I don't just do nutrition. I talk about emotions. I talk about power of the mind, and I love the alternative and natural therapies. So we address all those. Like for pain, people don't have to be in pain. There's tons of ways to get out of pain. But if you go to the doctor, you're going to get a narcotic, which is addictive. We like they keep you in the system. So deprescribing, my website's drleylaali.com. It's drleylaali.com. And
Perfect.
there's a place to sign up for there.
I'm going
The
to put the
books are on
website in
there.
the chat for you. It's right
Okay.
there. Guys, there's her website, Dr. Ali. That is a place where you can go. So it's what day of the week do you do the class?
Mondays at 11 a.m. Pacific time.
Mondays at 11 a.m. Alternative health. Dr. Leyla, I want to thank you for coming on the show. I got to get back to work. I only get a 30-minute lunch, and the phone's ringing like crazy, which is awesome. It's all positive stuff. Business. I love it. But I want to get you back on and get deeper into some of those alternative choices, like the water fast, like the diet, eating stuff like that. But let's get you on again on the regular and talk about this health stuff, because we all have, as we age, it only gets worse. It doesn't get better, right?
That's true. I mean, that's what we believe, right? But we talk about the power of beliefs too. So,
and you're saying different. So that's awesome. That's what I like to see. You see the difference, the way Dr. Ali talks about stuff. Can aging be changed by your health, by the way you eat, by what you drink, by your lifestyle? Can your health issues be changed by your lifestyles? Let's find out more. We'll have more of Dr. Leyla Ali on the show in the future. And also make sure you check out our website. I put the link in the Instagram. Guys, thank you so much. I got to get back to work. It's awesome. It's gonna be another crazy day. We'll be back tonight with our star of we got a girl coming on to later tonight. She's gonna perform for us. She's an amazing rock star. Her name is Shelby Knight. So we'll be back on at the 6 o'clock hour for our second show of the day with Shelby Knight. So make sure you join us back at 6 o'clock hour. Guys, thank you so much for watching. Have a great one. Have an amazing day. Doctor, again, thank you so much.
thank you. Appreciate it.
Awesome. Juice gang, gang, juice gang, gang. Stay thirsty, not dangerous. We'll talk to you soon. Have a great one.